Okay, this is chapter 9, and we will be doing parenterols, um, compounding steroid formulations. And this is a relatively long chapter, but it has many different components that may be found as part of the scope of practice of certain pharmacy technician, depending on what area that they go into. And we talked about that a little bit earlier in relationship to community pharmacy, hospital pharmacy. So you will find working with parenterals mostly in a hospital pharmacy setting. Okay, let's look at that chapter outline. We will be talking about compounded steroid formulation, looking at certain special consideration and regulatory oversight, LVP solution, and I will give you the definition of what LVP means, SVP solutions, and we'll talk about what those letters mean. Special solutions, administrative devices, laminar flow hood, biological safety cabinets, clean rooms, and then as septic techniques in hoods and cabinets, working with vials, working with ampules, syringe and needles, filters, quality assurance and infection control, parenterals incapabilities, units of measurement, and we may have a brief review. So what are your learning objectives? Well, at the end of this particular chapter, you should be able to understand the following. The requirements for steroid formulation, what are some of the differences that you find between LVP and SVP solution, and be able to explain the purpose of commonly specialty parenteral solutions, explain the importance of using laminar flow hoods and various aseptic techniques in compounding parenteral solution, listen and explain the factors that affect in capabilities in parental solutions, discuss the purpose of the different aspects of a quality assurance program, and also be able to compare and contrast the units of measurements unique to parental solutions. Okay, so let us go ahead and begin. And as with all of the other lectures, we'll always talk about thinking it through. And hopefully we'll be able to go back and talk about what you should keep in mind in relationship to the 3 points that they will bring up. So let's go ahead and have a discussion on this. So you're working at a home infusion company as an IV technician responsible for making all the intravenous solutions that are ordered. After turning on the laminar flow hood and completing the required cleaning of the area, you receive an order of 10 ampicillin 500 milligrams in 10 milliliters D5W. You collect the needed supplies and begin preparing the order. Halfway through the batch, your supervisor tells you to stop doing the ampicillin and do quickly 6 vancomycin 50 milligrams and 500 milliliters NS. After you read through this chapter, consider the following questions. 1. Should you stop doing the ampicillin batch and set the supplies outside the hood while you complete the vancomycin order, and then place the ampicillin materials back in the hood to complete the batch? Why or why not? Is there a clean room design that allows you to see the ampicillin materials outside the hood to complete the batch? Why or why not? And ampicillin has D5W as the base IV solution. Vancomycin has NS. Explain why both drugs are not placed in the same base solutions. Okay, so we're going to go over this and try to give you an understanding of why parenterals are very important and why there's a chapter on it. Okay, so let's talk about compounding steroid formulations. So for this particular type of products, there are special requirements of how it's made, how it's packaged, and how it's administered. And the reason why they have to be sterile is because of how rapidly it passes through the circulatory system. Think about 20 seconds for something to get into one's vein and throughout the circulatory system. So there's two reasons, well, more than two reasons, but two main reasons of being very careful with these particular type of formulations. One, because it's rapid access to the circulatory system, and if there's a mistaken dosage, either too much or too little, it's very difficult to reverse the challenge that occurs. Okay, three requirements are met by the manufacturers of a sterile parenteral dose. So, in addition of being a sterile dosage form, the parenteral formulation must, in most cases, have these three major points associated with it. One, be free of particulate materials. That means that anything else other than what is inside the medication, be pyrogen free, nothing that would cause fever, be isotonic, and be at the physiological pH. And we're talking about the pH of blood, which is 7.4. So this chapter will discuss how many types of sterile solution formulations are compounded in the pharmacy setting. Okay. So what are some of the special requirements of sterile formulations? So when we talk about sterile formulation, we talk about anything that is free from a bacterial contamination and does not have any type of microorganisms found in it. And so there are techniques that maintain sterile conditions and prevent the contamination, and those must be followed carefully. These are called aseptic techniques. It must have no particulate materials. That means that, for example, many of these containers have glass or rubber cores associated with the valve, may have contact with cloth and cotton fibers, metals, and plastics. And one must make sure that those particular materials are not given to the patient because it will cause challenges. The solution must also be pyrogen free. So what is a pyrogen? Pyrogens are chemicals that are produced by microorganisms that are soluble in water and are not removed by sterilization or filtering the solutions. And so they can cause a lot of challenges. And so those particular materials must not be found within the sterile formulation. And then the solution must be stable for its intended use. So most admixtures are prepared hours in advance of when they are administered. So the stability of the bacterial drugs in a particular intravenous solution must be considered in an admixture preparation. Okay, so those are some of the things that must be noticed. And finally, another point that should be noted here, it must be a physiological pH. And physiological pH is 7.4. Blood has a pH of 7.4, so anything under 7 will be too alkaline, too acidic rather, and everything above 7.4 will be too alkaline. Right? So this is something that is also very important. And then it must have a certain osmotic pressure. So when we talk about osmotic pressure, we're talking about the characteristic of a solution determined by the number of dissolved particles. So osmolarity is a unit of measure of osmotic pressure and expressed in terms of osmoles. So blood has an osmolality of approximately 300 milliosmoles per liter. Right? And so this is something that's very important in terms of some of the special requirements that we see necessary for sterile formulations. So let's look at some of the definitions that is also important here. We talked a little bit about aseptic techniques, and these are the techniques that allow for a product to remain sterile or without pyrogens, without bacterial contamination. You have hypertonic, means the solution has a greater osmolality than more than blood. Okay, and that means that it is greater than 7.4. And a little bit too alkaline. Hypotonic is when a solution has a lesser osmolality than blood. Well, let me go back and talk about hypertonic. Hypertonic. That is not related to acidity. And so it's basically defined as this: when a solution has a greater osmolality than that of blood. And when you talk about hypertonic, we're talking about when hypotonic, when it has a solution lesser osmolality than that of blood. Okay, and then osmotic pressure. Osmotic pressure is a characteristic of a solution determined by the number of dissolved particles in it. We have isotonic, when a solution has an osmolality equivalent to that of blood. And then you have pyrogens. Pyrogens are chemicals that's produced by organisms, and they can cause very severe reactions, such as fevers in patients. Okay, so let's look at some of the regulatory requirements that are associated with preventaroles. Okay, and this is very important for you to understand. So remember, compounding, as we talked about earlier, and we saw a video in that relationship, is regulated by the state. So state board has the regulation control of compounding. Okay, and there are different types of manufacturing and compounding standards in which compounding pharmacies has to adhere to, and they're found within the United States Pharmacopoeia, and they have several different products in which governs the process of compounding. And some states have use standard as is, and some states has standards that may be more stringent than what you see in the USP regulation. And so the USP, which is the United States Pharmacopoeia, the Food and Drug Administration, FDA, and state boards of pharmacy and regulation and guidelines for the manufacturers, create guidelines and regulations for the manufacture, compounding, dispensing, and distribution of parenteral drugs products in the United States. Okay, let's continue to look at some of the regulatory compounding. As you look over here, right here, 795 deals with non-sterile compounding, while 797 deals with sterile compounding. How do you go about making these particular type of preparation? Remember, we talked about it in relationship to preventing microbial contamination from bacteria, fungi, etc. Excessive bacteria endotoxins, and these sometimes are pyrogens that can cause fever in patients. Preventing large area and strength of the correct ingredients, which can be very damaging to the patient, and then having things that are in it that should not be there. Okay, so these are just some of the points that you should be familiar with. Okay, so let's go ahead and just begin to take a look at some of the different types of sterile formulations, and we are going to go into them in a little bit more details for the next segment. But just to touch up the base, when we talk about injectables, we talk about that in relationship to IVs, IM, SCs, IDs, and we will go into a little bit more details in section 2 for this particular chapter.